Good day everyone, I am Ian Grace Mayorga from Cavite State University main campus, and I'm going to show you the return demonstration of the nasogastric insertion in the patient's nostril. So first is we need to always remember that we cannot perform the procedure of the NGT insertion without the client's diagnosis and the doctor's order. We may also need to identify the client for the nasogastric insertion by using the three-way identification. So, ma'am, ako po si Ian Grace and kayo po si?
Angeline po.
Okay, ilang taon na po kayo, ma'am?
13 po.
Kailan po ang birthday niyo?
November 19 po.
Okay, may I see your bracelet identification? Okay. So, next is we need to explain the procedure to the client. So, ma'am, nandito po tayo today to perform the insertion of the nasogastric insertion. So, meron po tayong tube na ipapasok sa inyo pong nostril for us to administer food and medications po in that tube for you to heal easily po. Would that be okay with you po?
Yes po.
Okay, so next is we need to provide and secure the consent for the invasive procedure, and then let's proceed with the implementation of the procedure. After assessing if the client is able to cooperate with the procedure, we may need to measure the tube if whether the tube needs to be put in the suction or in the bedside bottle. And of course, we need to assemble the necessary equipment and supplies such as the large or small bore tube, the non-allergenic adhesive tape, disposable gloves, water-soluble lubricant, the facial tissues, glass of water and drinking straw, 20 to 50 millimeter syringe, the basin, the stethoscope, disposable pad or towel, the clamp or plug, but this is optional, the suction apparatus, and of course the gauze square or the plastic specimen bag and elastic band. Next is we need to assess the clients to a high Fowler's position, specifically 30 to 45 degrees, if his health condition permits, and support his head on a pillow. Then re-explain the procedure to the client and why it is necessary and how the client can cooperate. And also, we need to provide the client a complete privacy by closing the doors, by simply closing the curtains all throughout the procedure. And in assessing the client's nearest, we should ask the client to hyperextend his head and using a pen light, observe the intactness of the tissues of the nostril, including any irritations or abrasions. The next is we may need to inspect the nares for any obstructions or deformities by asking the client to breathe through one nostril while occluding the other. And then select the nostril that has the greater airflow. Prepare the tube, the plaster for anchoring, the stethoscope, the aseptic syringe, and the bottle as needed. Then put on the gloves and determine how far to insert the tube. We can determine how long the tube to be inserted by using off the distance from the tip of the client's nose to the tip of the earlobe, and then from the tip of the earlobe to the tip of the xiphoid process. then next, we may need to insert the tube by first lubricate the tip of the tube well with the water-soluble lubricant, and then initiate the insertion at least 3 to 5 inches and secure the patient's cooperation and facilitate comfort by instructing patient to breathe. Once the tube reaches the oropharynx, the client may gag and retch. We may need to ask the client to tilt his head forward and encourage him to drink and swallow. Next, we need to verify the placement of the tube by auscultating the air insufflation by placing a stethoscope over the client's epigastrum and injecting air into the tube while listening for a whooshing sound using an aseptic syringe or a 50 ml syringe. Okay, hearing the whooshing sound in the client's stomach means proper place or proper placement of the tube in his nostril. Then next, we may need to secure the tube by taping it to the bridge of the client's nose and anchor it as possible. And then we should remove our gloves and wash our hands for the safety of us as well as the client. And then we may need to document the findings for the relevant information that may be needed in the future purposes of the client.